Hello everyone, this is Dr. Sue from Purely Pediatrics. For my week coming up this week, I wanted to talk about fevers. If you had missed any of my information that I provided with regard to rashes, please make sure you take a look. There are two, one audio, one video, two sources of information that may solidify some thoughts that you may have about your little one and rashes, whether it's now or in the future, so you'll be able to access it any time. With regard to fevers are something that I feel that no matter how many times our child gets a fever, it's still nerve-wracking. And we will talk to families multiple times over the course of a year and then the next as well with regard to fevers and fever management. So I want to just talk about fevers in general. Is a temperature that is 100.4 or higher. I usually tell families to keep the number 100 in mind. Until that temp reaches 100, it is not really considered a true fever and not a concern in the medical world. Not that it's not a concern in the parent world, but I want you to know that if you talk to your doctor about what you call a fever and it's below 100, they likely won't worry too much about that. So I'd like you not to worry too much about that either if we can. So 100.4 or 100 degrees Fahrenheit is a true fever. The best way to take a temperature in an infant 18 months and under is rectal. Please, please, please get a simple digital thermometer and use that rectal temp in order to get the most accurate temperature for your child. When somebody calls me with regard to a fever that belongs to my practice, I always ask them, if they're 18 months and under, did you take a rectal? And if they didn't, I ask them to do so. Unfortunately, the temporal thermometers, the ear thermometers, they just aren't accurate. A core body temperature is truly a rectal temp in children under the age of 18 months and under, and for 18 months and over, the axillary temp or under the armpit, as well as the oral temp, is the next best way to take a temperature. After the age of 18 months, you really do not have to take rectal temps any longer unless you feel that it's easier for whatever situation you have with regard to your child. Once we figure out that our child has a true temp, what I try to do is talk to families about the reasons why we try to minimize these temps. When children have fevers, it makes them breathe faster, it makes their heart rate beat faster, and it therefore makes our metabolism higher. What this can do is if little ones are sick and not feeling well and they have a fever, sometimes they don't want to drink. And in order to keep up with that increased metabolism created by the fever, we want to make sure that our children drink. And I'll talk about some fluids in the next fever video that we do have. But with regard to fevers, that is the true reason. We try to keep those temperatures minimized if we can. Dehydration in children can happen rather fast. Usually you're looking at a 24 to 48 hour period. And the smaller the child, the more easier it is for them to become dehydrated. So that is the reason why we want to make sure to keep those fevers down if we can. So if I get a phone call, just for an example, that there's a 2-year-old that has a fever of 102.5, I know that that little one is fighting basically a virus. The only time we would really think about bacteria is if things were more prolonged, but that's going to be another discussion that we'll have. But with regard to that fever, the likelihood of it being a virus is almost 99.9% of the time. I usually tell families that viral fevers can last a couple of days. Sometimes it can last a few days, particularly if it's COVID or influenza related. Those fevers can last much longer. So what I will do is ask families to take it 24 hours at a time. I'll ask them to go ahead and treat the fever with Motrin or Tylenol. If a child is 6 months and over, they can get Motrin, or ibuprofen is the generic name. And Tylenol, acetaminophen, is also available for fever relief. Children under the age of 6 months should not ever receive ibuprofen due to the immaturity of the kidneys. So children that are under 6 months of age, I always tell families, stick with Tylenol. You can give it every 4 hours and take it 24 hours at a time. With a fever, I'll ask families to at least keep giving that medication, say it's Tylenol, every 4 hours at a time until the next day. And if the next day they run a temp, go ahead and start that another 24 hours. And this will help keep that fever down instead of going up and down, which really isn't good either because it still makes the little one feel pretty crummy. One other item I wanted to mention for this informational piece is that you can alternate Motrin and Tylenol as well as your child is 6 months and older. And what this means, you want to make sure to give the appropriate dosing, which is based on weight. So always talk to your pediatrician if you're not sure. And what you want to do is you can give one of those medications every 3 hours. So say you give Tylenol at noon, and that is an every 4 hour medication. So what you're going to do 3 hours later at 3 o'clock is give a dose of ibuprofen. And that again is weight-based dosing. 3 hours later, you're going to give the Tylenol dosing. And you know it's okay because the Tylenol is gone longer than 4 hours, so that's no issue at all. And you can do that if you feel like those fevers are not being taken down with one medication or the other. I generally tell families only to alternate if the temps are on the higher side. And higher side is 102.5 or higher for my opinion. But if the fever is being well managed with just the use of ibuprofen or just the use of Tylenol, then I tell them to go ahead and just continue with that one medication. So for this time, that's about it. That's all I wanted to talk about fevers for this piece of information. I hope this is helpful. Remember, fevers are not a medical emergency unless they are in children 8 weeks old and younger. So fevers are never a medical emergency in a child over the age of 8 weeks. I hope this is helpful. Stay tuned for our next piece, which will be a video with regard to fevers as well. Thank you so much.